Well, it made headlines for all the wrong reasons, didn't it? But authorities in Norway are investigating the deaths of at least 33 elderly Norwegians who received Pfizer's COVID-19 vaccine.
It's dealt a blow to community confidence with concerns raised around the vaccine safety. Dr. Steinar Madsen is the medical director of the Norwegian Medicines Agency, and he joins us now from Oslo. Doctor, thank you so much for your time. As Carl just mentioned, that this story has gone global, and I think the big question we all want to know is, did the vaccine cause these deaths?
No. All of these deaths were caused by the severe underlying diseases. So the vaccine is not the direct cause of all these deaths, these 33 deaths that we have recorded so far in Norway.
So what happened
it's not the vaccine. What we think that in a few of these patients who, in fact, were terminally ill, they had some adverse reaction to the vaccine, like fever, nausea, and feeling unwell, and we think that may have tipped them over with a very, very serious diseases. Many of these patients were terminally ill.
So is it this idea that whether or not they'd had this vaccination, that the thought is these patients would have died anyway, or has the vaccine played potentially some role, however minimal, in their deaths?
The connection, we are not sure about the connection, but that's what we are looking into. Most of these deaths are pure coincidental, that it came shortly after vaccination. And you have to know that we have vaccinated between 20 and 30,000 nursing home residents in Norway, and most of these patients are very ill and very old people.
It's interesting given how early it is, and you've got another round of these injections to come, these vaccinations to come. I think in Germany they've had something in the order of 10 people who have passed away. The absolute link obviously to be established still. There's some talk around the world about switching to the AstraZeneca vaccination because it's a little bit lighter for people to handle. Are you going to do that, or are you going to stick with the second round?
We stick with the second round, absolutely. So we started vaccinating the second round today, and we will not change anything in our plans. So we continue as planned.
So how is it in your mind that, as you say, all these patients were very elderly, they had a lot of underlying, very serious medical conditions. This story has gone global. These deaths are being linked to the vaccine, or certain questions are being asked. How did it get to this point?
I think that one of the reasons was that our national broadcasting system put out an article on screen with a very tough headline. So in fact, that was what started it all.
Okay, but you have no people who are plus 75 years of age or plus 80. Are they expressing, after seeing those headlines, concerns about a second round?
No, not at all. I mean, this was we had it on the news last Thursday in Norway. After that, we haven't heard anything. So right. In Norway, we are very calm, and we are not worried about this.
Mm-hmm. So we're obviously still waiting for the rollout here in Australia to begin. Are you saying that Australians don't have anything to worry about? Because if you're over 85 and have an underlying health condition, would you be recommending someone like that to have this vaccine?
Absolutely, because we have experience from very sick, very old people, and we see that adverse reactions only occur in a very small number of these patients.
They're very damaging, those headlines, weren't they?
Yes, they were. Unfortunately, they were.
Okay. I'm good to talk to you. We'd love to talk to you again after the second round rolls out. Thank you for your time today. Really appreciate it. And I think world authorities, especially through Europe, Germany, those results have been closely monitored, and wherever it's being rolled out, the results are being really closely monitored. And I think even here in Australia, they're looking at the possibility of the AstraZeneca being the one that is administered to
the elderly and the vulnerable.
plus 75, yeah.